Muy buenos días a todos.
Good morning, everyone.
Muchísimas gracias por estar conectados en
Thank
este
you very
evento.
much
Me
for
gustaría
connecting
presentarme.
to this
Mi
event.
nombre es Maricho, soy
I'm
asesora
Dr. Mali Cho. I am
recursos
the
humanos para la
advisor
salud
in
del
human
Departamento
resources
de
for
Salud
health
y
from
Servicios de Salud de la
the Department of
Organización Panamericana de la Salud.
Health Services from the Pan American Health
Antes que
Organization.
nada, pues agradecerle por su tiempo
So I thank you
y
for
por
your
su
time
atención a este evento,
and
que es
for
el
taking part in
lanzamiento
this
de una
event, which
curso
is
virtual que
the
vamos a
launching of the
comenzar.
virtual course, Self-Learning Introduction to Planning Human Resources for Health for Universal Access and Coverage. This course seeks to make available to the largest possible number of decision makers concepts, strategies, and reflections, thoughts that are necessary for proper HR planning for health. The appropriate planning of this group of people and training in order to ensure care be made available to the population to move toward universal access and coverage. So in this course, we are going to address different planning models. However, we do think that it's very important to remember that planning for HR and health is not an exact science, and therefore there needs to be a refresher, an updating of this process on a regular basis. We have to take stock of the future and present supply and demand. This is a political process with many different scenarios and multiple players, which makes the task that much more complicated. Let's not overlook the changes in the demographic, socioeconomic changes that have taken place, that take place, and can have bearing on the health policies that countries adopt. Our recent experience with the COVID-19 pandemic shows the need to strengthen the knowledge of management teams for planning human resources and health, in which having information is strategically important to be able to identify, manage, uh, and redistribute healthcare workers according to needs. We hope that this course is of interest to everyone who works as an administrator or a technical expert and who in different areas of health manage healthcare resources, human resources, whether at the local, national, uh, subnational level, public or private. And so we seek and hope to be able to strengthen management teams for planning uh, human resources for universal health and access. I thank you all for being here. And I think you must have already received the agenda. Now we're going to hear some comments about the importance of planning in HR in order to achieve universal access to health and universal coverage. So for this, I have invited Dr. James Fitzgerald, the director of the Health Systems and Services Department of PAHO, as well as heads up the HR department of PAHO. James, you have the floor. Thank you very much, and good morning, everyone.
I'm the director of the Department of Health Systems and Services at the Pan American Health Organization. I'm going to talk this morning in English, so I understand there's interpretation available, so feel free to select the necessary interpretation if you so need. So a very warm welcome to you all. Thanks also to Mali and all the team for really organizing and structuring this process. A special welcome also to Lida Mercedes Sosa, the Vice Minister of Stewardship and Health Surveillance from the Ministry of Health in Paraguay, and of course to Cristina Caballero, who is the National Director for Strategic at the Strategic Directorate of Human Resource for Health Paraguay. We're really happy and honored to have them with us this morning, and they are going to be giving us a comprehensive overview of the challenges and opportunities that we face in terms of health workforce planning within the context of Paraguay. Before we get to that, I really wanted to say a few things around the importance of this course that we're launching through the PAHO virtual campus. And really position it within two individual but complementary contexts. The first context is the fact recognizing that hopefully we are now slowly coming out of a pandemic, the worst pandemic that we've experienced in over 100 years, in a region that has been the most impacted of all regions within WHO. We've had the highest number of cases per 100,000 of population, with the highest number of fatalities. This is an indication of a number of things, but most notably the challenges that health systems faced in being able to adapt surge capacity and manage the massive influx and the continuous waves of COVID-19 that we experienced throughout the region over the past 2.5 years. One of the challenges I think that has been critical both to the overall context, but also the response that the countries could launch against COVID-19 was the health workforce, and how that health workforce really adapted and responded to the needs. And I think it behooves us all to really recognize the efforts of every single person working in health, and particularly those in the front line that have been managing this pandemic, irrespective of whether it's a primary care level or within the hospital context. The second context I really want to present for you is the fact that we still have a very long way to go in order to achieve the overall vision of universal access to health and universal health coverage in the region. The region is making advances in terms of access to services. And as we look at the advances in the SDGs relating to 3.8.1 and 3.8.2, the overall arching indicators that we have to report against, we see that access to health services has significantly improved in the region of the Americas over the last 10 years, almost achieving the overall objective of that magic number of 80, which is the services index that has been defined by WHO as a target for the region, while at the same time improving financial protection. Now, very important to note here that these are averages. These are single conglomerate numbers that attempt to measure the capacities of all countries. And as we know, the region is one of the most inequitable regions in the world. Inequities persist in access to health services, particularly for vulnerable populations. So these numbers, even though we see progress, don't really capture how the region is advancing in closing the gap between those that have access and those that do not. One of the key areas in this is primary health care. The expansion, the urgent need to address primary health care with greater deployment of interprofessional teams in rural and underserved areas, while at the same time we address the health workforce needs in integrated health services right through to the tertiary level in specialized care. Both of these contexts have been subject to long-standing systemic deficiencies in the region of the Americas. The response to COVID-19 and the inability to address the inequities in health have been a consequence of underinvestment in health systems and the lack of due attention to really substantive health sector transformations that put people at the center addressing their healthcare needs. And no more do we see this in the area of health workforce planning. We are still, in many cases, in situations where countries do not have directorates or individual oversight mechanisms, not just for human resource management, but actually for workforce development, workforce planning, workforce policy development, and workforce policy implementation. We see, as reported recently in the latest numbers from WHO, and as we reported also, we have an absolute shortage, an enormous absolute shortage of about 600,000 of health workforce across a number of categories within the region. The health workforce stock is improving within the region, but slowly. And as we've seen from COVID-19, while we face the slow, I would say, the slow increasing in the numbers of those that are interested in working within health systems, we also see a depletion of our health workforce directly due to the pandemic as a consequence of fatalities, but simple burnout as well. All of these are critical factors that need now to be addressed if we are really going to be, one, better prepared for the next pandemic, which could be in 2, 5, 10, or 15 years, and or if we are really going to be able to be substantively addressing the major challenges that face us to ensure universal access to health and universal health coverage as health systems transform. Health workforce planning is critical to this. Many countries, when we have new administrations come in with very ambitious plans and programs to change, to transform health systems, to really address the needs of the population. And as they do so, they suddenly realize we will need people to do this. We will need a health workforce fit for purpose, well deployed, well educated, that can address these problems. But we have to remember that in order to train a nurse, it takes essentially between 2 and 4 years, a doctor between 5 and 7 years, and even some of the other competencies that we require anywhere from 6 months right through to 5, 6 years. It takes time to develop the workforce. And part of that, and not notwithstanding the continuing education requirements that are required. As such, the issue of workforce planning is critical. It's critical to the development and the reform of our health systems to be able to address population needs. And it's a critical component of the actual health sector reform process, because as we review the model of care to progressively expand access to health services at all levels of the system, we need to be able to look at what competencies we need, what are the combination of those competencies required, how do we educate the workforce to that purpose, and then how do we plan and deploy them in a manner that we can retain them in the positions that they're ultimately going to be recruited for. And so this overall course is really critical to the PAHO strategy in continuing to develop workforce capacity. A final note, at the recent Summit of the Americas, the Pan American Health Organization, jointly with the US government, announced the America's Health Corps initiative. This is an initiative really to build health workforce capacity throughout the Americas, with an overall target of increasing health workforce in the order of 500,000 over a period of 5 years. We're going to be working with all our countries on this initiative with the support of the United States in addressing the gaps at the national and the subnational level, and beginning to work countries in this planning processes so that we can begin to allocate the necessary resources to really increase capacity and increase the numbers of health workforce that are required to ensure health objectives. So we really look forward to working with you on all of this. This course is a critical component of it, and so we really urge you to benefit from it in terms of substantively transforming our health systems for the future. I leave with that, Mali, many thanks. Congratulations to you and all the team for developing this course. We really look forward to hearing from everyone that is participating in this and seeing this as one step in an overall process to really expand the numbers, expand the quality, improve the distribution of our health workforce in the future. Thank you very much.
Muchísimas gracias, James, por esta visión macro de
Thank you very much, James, for that overview of the healthcare systems in the Americas, incorporating the vision of equity and primary care throughout the process so that we can achieve universal access and coverage in health. So once again, I thank you for telling us about this new strategy and what plans are for the future, what's being done over the last couple of years. The COVID-19 pandemic experience has driven home how important it is to have sufficient human resources for health in order to be able to increase access and coverage to health for the population. So I thank you very much. Now we're going to hear about a country experience. We asked Dr. Cristina Caballero, the National Director of the Strategy for HR for Health in Paraguay. We asked her to present on planning human resources in her country and what the challenges and achievements were during the COVID-19 pandemic. You have the floor, Ms. Caballero. A warm greeting for everyone, the Public Health Ministry and Well-being through the National Office on Strategy and HR in Health, working with WHO and PAHO. That is, we thank PAHO for inviting us in this process in the framework of the national policy to build human resources in health 2020-2030. I'm going to share my screen to show you a presentation. And you see the screen. I'll commence. Yes, we see it quite well, please. I'm going to turn my camera off to avoid this presentation slowing down. Now, this presentation, within the context of the launching of this HR in Health course for universal access and coverage to health, represents a wonderful opportunity to show how strengthening and building the knowledge of the team and the in line with our national strategy for HR and health and working with other areas within the health. We've had the experience of past courses. All of this has made it possible for us to all speak the same language and to forge ahead in this process of planning human resources in health in Paraguay. Now, to talk about the planning process for HR in health in Paraguay, I thought it would be germane to talk about how this is connected to other areas of planning, courses on planning, and when these courses are put to good use, they can be very helpful to complement those processes that are tied to HR planning. That is, to go from theory to practice, almost at the same time that we are learning about experiences of other countries. Taking part of these courses, we're going through our own learning process. So planning, human resources, and health. And we see this as a political and technical process involving different scenarios and a host of actors. We need to understand that this HR and health is a social field that enables us to understand the interaction with the culture of the population and how this relates directly or indirectly with the development of human resources in health. So how did we start working in Paraguay? Who was heading up this process? And what progress has been made for us to reach the goal of the number of skilled people? There would be a sufficient number of skilled people to fill all of the posts and at the right time. In 2020, the National Office on HR Strategy for Health updated its strategic lines of action, now tied to strengthening stewardship and governance for the implementation of a national system that builds human resources and health and to develop the necessary skills and conditions for HR to move toward universal access with a primary healthcare focus working also with the academic sector, the National HR Strategy Office, guided by this strategic line of action with the goal of bringing together all the different players that are part of training HR in health within and outside the executive branch, uh, led building the national health policy, which was updated in 2020. They culminated this year a process that started years back with the support and cooperation of the Pan American Health Organization. This policy established 3 lines of action. The strategic lines are the National Health Policy of Paraguay, and this is in line with the HR strategy for health to achieve universal health coverage and access of WHO and PAHO with the National Development Plan for Paraguay 2020-2030 and the National Policy 2015 to 2030. That's how we got started. Now, the Public Health Ministry and of Well-being, through its national strategic offices of HR, which is heading up this process of crafting and implementing the national HR policy for health. Now, I would like to talk about how we are progressing. There's a chronological order formed around national HR strategies. When we talk about how these strategies are being designed and implemented now, and then strategy 1 of comprehensive development of human resources, and 2, strengthening stewardship and management of HR in health. We put together a national committee to implement national HR resources in Paraguay 2020-2030. I should say that this also has to do with recognizing what the different scenarios are to build this policy and to make it viable. To ensure it's viable, we have to first identify who the key actors are, and then we have to understand how these actors interact to see who we need to invite to be a part of this committee for the implementation of this policy. So within the framework, again, to put this committee together, institutions were convened that are tied to HR and health, education, work, finance, and health from all these different areas at the highest level to craft and implement policies, interventions, and legal frameworks for HR and health. We have members here from the Public Health Ministry, from different offices of the ministry, which are strategic in the support they offer and of services. And we also have members of other institutions, the Ministry of Education, of Science and Technology, Civil Servants, Secretariat. You can see them on the screen, all of whom are very important, and they were convened based on an analysis that was conducted in an effort to map out key actors. Now, this committee has different functions to validate the implementation plan for the national policy of HR and health, and to suggest and to approve the technical tables that will be doing the work, as well as the plans and projects that are to be put together by the members of these technical boards to bring together the different mechanisms and to make cross-sector and citizen participation easier, to monitor the degree of compliance with this policy. Now, this committee held its first meeting in the first half of this year, in which the action plan for the implementation of the policy was submitted for its validation, and the first technical boards were put together to fulfill strategy 2, strengthening the stewardship and management of health authorities in the area of HR for health, and 3, the implementation of the National Strategic Information System of HR. A technical board was put together for the comprehensive planning of HR in health.
And this was all done with the support of PAHO, and we're working on the situational diagnosis for human resources in health in Paraguay. And this will allow us to identify what are the gaps regarding training, amounts, skills, gender development, and distribution to be able to establish strategies for monitoring and follow up of the processes and results. So we are working on the module of the planning of human resources for health and what the countries use. So we have had limited resources, so to speak, to be able to identify which is the most adequate methodology in this case of Paraguay within the national health system and within the different subsystems. Also, we have worked within the framework of the National Committee. We have worked on the establishment of a technical roundtable for regulation of the intersectoral work within the framework of the regulation and recertification for special professions and specialties. So the Ministry of Health has opened this door with a catalog for professions of health. And in this case, we will be ordering the classification of all of these health professions. At the present time, we are working on the development of specialty catalog, specifically targeting medical specialties. And this is joint work with different ministries, such as, for instance, the Ministry of Education and Science, the National Council of Higher Education, scientific societies, and different areas of medicine. Another strategy that we're working on is the implementation of the National System of Strategic Information for Human Resources in Health. And this is like an observatory of human resources in Paraguay. And this has to do with the use of learning modules that have a technical and political approach and an integration approach. We will be working with the human resources assigned by the Ministry of Health and taking into consideration the percentage of the population that at the present time is working with external actors within the national health system of Paraguay. So here are some data for your information. And then within the strategy number 6, we have had the education and training of human resources in health, and always coordinating our work with different sectors and with the Ministry of Public Health and Social Well-being, and also with different training institutions working in the training of all these human resources, and also to be able to foster alliances and agreement among training institutions and the health sector based on the standards and protocol developed by the Ministry of Health as basic materials for the undergraduate, graduate, and postgraduate programs in health. We have been working together with the Ministry of Health, taking into consideration the installed capacity of the different health facilities to be able to work on the regulation, monitoring and performance. Also, we have been conducting virtual training courses for human resources together with the educational institutions to make sure that we have a large enough base of human resources in public health. So this is a very fast overview of what we have been working on. And within the framework of human resources for health, we have to have a consolidated culture, a consolidated practice, and we have to have political support and political will. And we are having that at the present time to be able to advance in these processes. Thank you very much to PAHO for their kind invitation to be able to show this summary of what we are doing in Paraguay. And thank you so much for the technical support received. Thank you very much. Thank you so much, Dr. Caballero, for your excellent presentation. I would like to congratulate you for the work that has been developed in Paraguay regarding the topic of human resources for health. And thank you so much for underlining the importance of having political support so that the technical aspects can be achieved. Thank you so much for your presentation. And now I would like to go to the presentation of the course itself. And I would like to invite Dr. Maria del Carmen Cadile, who together with Dr. Rodolfo Levin were the two professionals who created this course of introduction to planning of human resources for health. And Dr. Cadile will present the details of the courses. Marita, please go ahead. Thank you so much, Mari. Do you see the presentation? Can you please have the presentation mode? Thank you. Good morning, everybody. It is a pleasure to be here in this meeting and to be able to present this initiative. Before beginning, I would like to thank PAHO for the confidence given to our team. We had the challenge of developing this course for the first time. This is a self-learning module and course, and I would like to express my thanks to the team that accompanied today, Dr. Mali for the coordination, Dr. Rodolfo Levin, Gabriela Rodriguez, who is part of the virtual health field. Thank you for her advice and for the preparation of the proposal, and Larissa Lozan, who was responsible for the English version of this proposal. So we would like to present the proposal, and then hearing Dr. Caballero was very important for us to have this experience on the presentation of the course, because this shows how planning works when we have time to think about it as a political action and a technical tool. So you have already heard my colleagues who have spoken before me saying that planning is not an exact science and we have to have models. And these models assume a series of proposals and protocols to see how this will work. And also they require evaluation of the different scenarios and contexts in which we will be developing our process of planning. Of course, as we mentioned before, the pandemic left us many lessons, and it clearly showed us the dynamic and complex field in which we work and how there are many uncertainties within our projects. The purpose of this course is to generate a critical mass of health personnel to strengthen human resources policies and management and their positioning in the regional and national agenda towards universal health. So we have the target audience for this course as all the people responsible for technical equipment, technical teams in the areas of planning and management of human resources at the national or subnational health systems, the ministries of health, social security institutions, public health institutions, and different management authorities of integrated networks for health and people responsible for educational planning. So this is the higher education sector of the Ministries of Education. Also, they are the part of the target audience because they are the one that train human resources in health. They guarantee part of our process if we call them to the table. And also we have the people responsible at the universities and technical schools dedicated to the training of technical and health professionals, talking about the offer of education possibilities. So the general objectives of the course are to understand the planning of human resources in health targeted towards universal health as a complex process and the conditions for their implementation. It is important to take into consideration these conditions. And also we want to strengthen the capabilities for planning of human resources in health of the management teams within the framework of the strategy for universal health coverage and access. Objectives, specific objectives, we have to establish a context for planning human resources as a political process. And this is intersectoral and interinstitutional in nature. We saw this very clearly in the presentation from Paraguay, how we have to include all the actors that have to do with the training and management of human resources to be able to forge ahead with this process. We, from the health sector, cannot work alone. To identify all the management, training, regulation processes. All of these processes require links between health and other areas. And that's one of our specific objectives. Also, we will be determining the different modalities for planning, their aims, and the different challenges for the development within uncertain contexts. And finally, we are going to be identifying the different components of the human resource training in health. What are the alternatives? What are the challenges for the establishment of these components? So the structure of the course, as we have thought about, has 4 thematic modules. Each one of these modules you will show you materials from different kind, videos, bibliography, exercises. So the idea is to be able to go through each one of the thematic modules. We want to give you a library, so to speak, this virtual library, so that you have all this information that we have collected. So, and then each one of you will go and take the course at your own pace, form your own library, and go deep into whatever you consider are priorities for your countries and for your systems, health systems. And then in addition, the course will propose the integration of all of you to a planning mechanism that allows to cover the 4 modules, and you will be invited to go to an imaginary country of the region. And then that country, that imaginary country, will have to put in place a planning process. As you, as part of the team, will have to make decisions, work with the authorities of the imaginary country, and think of a model in accordance with the needs and the realities of that imaginary country. Module 1 will allow you to go through the different scenarios for planning. You will have strategic plannings and the construction of feasibility. You will have theoretical tools there as a basis for the analysis, understanding that this is a political process that has to be aligned with health policies in the country and also with the context of strategies of coverage and universal health coverage and universal health access. Module 2 will have us working on information system. And these information systems are thought about like something targeting governance in a planning process, how to work from a perspective of thinking about information as a production of statistical data and information system. And also, many times, we think of systems as a strength, but maybe the strength is the coordination of all of these systems. So we have to consider this as a theoretical model for relations in which we can build baselines on availability of information based on what every country has. And then finally, in module 3, we have the planning of human resources for health. We have several methodologies for diversity in the countries and their respective needs and priorities. So if our objective here is to have planning of human resources in health with equitable distribution of the teams to be able to achieve health goals, we have to determine which are the stages of planning, which are the models that are best used for this situation, and what are the planning stages in an application in different scenarios. And then finally, you can access freely to this course. This is a self-learning course, as we had said before. After after a few days of opening this course, we already have 50 participants. We already have received several comments that are very favorable, and we're very happy to report that. And then the number of hours is a total of 15 hours in the course. And then you will perform a partial evaluation in each module. We have included 20 questions to make sure that we are achieving our targets. And then at the end, each person who takes the course has 5 intents to solve any problems, and then we will give them a grade at the end. And we hope that this course will be a good tool for you to accompany you in the planning of human resources in health in your countries. And we hope that this will be useful and that this will open doors for the work of each team and each manager in their respective countries. Thank you so much. Thank you so much, Marita, for your presentation. Yes, of course, as you can see, this is a course that is an introduction to this planning of human resources in health. As we mentioned before, planning is a very complex process that requires information, requires other components that we have to work on them. But the development of this course has given us this dynamism, this dynamic nature to incorporate data that are necessary to be able to advance in the planning process. So we encourage each one of you to participate in this course and to invite others to participate. And then that way you will be able to expand your knowledge. And then also you will see the need for planning in the short, medium, and long terms through these projections. And also you will be able to identify the needs of the imaginary country based on the models used. Thank you so much again, Marita. And now, since the course is part of the Virtual Campus in Public Health of PAHO, in that platform that we have at PAHO, I would like to ask Dr. Gabriel Litovsky, who is the coordinator of the Virtual Campus on Public Health at PAHO, to present this virtual campus. And then Dr. Isabel Dure, who will be representing Dr. Gabriel Litovsky. Isabel, thank you so much for being here today and for this presentation. You have the floor now. Thank you so much, Mali. I will be sharing my screen. Can you see it? There, okay. I have to convey the greetings of Gabriel Litovsky. He's the regional coordinator. He's not here because of an emergency, but this is a course related to the educational platform. And then the campus is the educational platform at PAHO, and it contributes to the developments on capabilities and skills for health workers in support of transformation of services and public health practices in the region of the Americas. This is open training for each one of the health workers. This is has a wealth of information. So the campus has principles aligned with the values of PAHO. It is a public good. It is an educational model for permanent education. And it shows that learning is a collective and social process that is conducted in collaboration. And we are always thinking of relating this model to the educational proposals and education itself to widen knowledge. So we have open and interoperational resources, and we have a collaboration in our management, and also this is characterized by sustainability. And it doesn't have any direct cost for any health workers. So during the establishment of this, and then also during the pandemic, this was a very important resource. And we are very proud to report that many areas of the organization have been able to support health personnel in the development of these courses. And also we see here the total number of users. 15% of the users of these virtual campus are linked to the management processes. So this is a cooperation targeting management of human resources in health. And we have to, of course, work in the human resource policies of the organization, and to underline that this has been very important for policy management, planning, and health and safety. And then in the past few years, we have had several proposals for self-learning. So I would like to invite you to register in this course, but also to share any proposals that you may see in here in this virtual campus. So the course was presented by Marita. I just wanted to tell you that you can just go into the virtual campus. For those of you who have never been there, you have the arrows that shows you have self-learning courses. You can create an account, and then from there on, the platform directs you. Here we have underlined the introduction to the planning of human resources in health. Is already in Spanish here, and it's already in English here. As Marita has said, you will go to the portal here. Very briefly, these are the recommendations for self-learning courses in the virtual campus. For those of you who are interested, try to organize your time and space to go through the course and then write down the activity in your agenda. Also, exchange information with your coworkers, share materials, use this forum as something available for exchange of information with the colleagues and also with professors. And make sure you inject enthusiasm when you talk about this virtual campus activity. And make sure you make the evaluation. This is an important opportunity for formative learning. Do not be afraid here. You have opportunities for learning here. Also, we have a survey on the quality of the virtual campus. And then you can just download your certificate of approval at the end of the course. And then, of course, you have many proposals in the virtual campus that are pertinent to your situation. And the most important thing at the end, you will just be able to download your certificate of approval. So this is the certificate. It is designed for this course. And it shows that you took it for 15 hours. And then you have a table for help, asking for help in case you have any problems. This is available. This is the help desk. And thank you so much. And I hope that you will have had a pleasant experience and that you will be able to take these courses. Thank you. Thank you so much, Isabel, for this presentation. This is always useful, taking into consideration that any course that we are developing is within this context of the macro context and overview of the virtual campus. And what we're presenting right now offers a variety of courses and training sessions on different topics. And this material is important on the topic of technical cooperation offered by PAHO. We are just close to closing time, but I would like to ask you if you have any comments. I would like to give the floor to one or two participants in case you have any questions. We will not be able to answer questions, but if you want to make a final comment, please do so. Raise your hand. Bruna can give you the microphone, give you the floor. And then while we wait for that, I think someone raised their hand. Roberto. Bruna, can you please give the floor to Roberto? Roberto, please unmute your microphone.
Can you hear me? Yes, we hear you. Thank you. Hello, colleagues, participants. I would like to congratulate everyone who has made this course possible and available on the virtual campus. I've seen the different modules, and I see that it's a compact version of a earlier course that was many hours longer. The idea is to make this course available to many more people in countries, in health ministries, and I think that this is really going to be helpful in the case of Olivia. PAHO is helping our Ministry of Health to put its HR plan together and carry out that action plan through different courses. And what we saw in the case of Paraguay, the mapping of actors, the identification of needs, and so forth. I think that this is a course that's going to be very helpful for countries to improve their planning, especially at a time in which countries are at a juncture overhauling their HR plans and distribution of HR resources in keeping with new needs and the policies of each country. Thank you. Thank you, Roberto, for that remark. I give the floor to Cecilia. Please turn your microphone on.
Me da la impresión de que Cecilia levantó la mano de
I
manera
thought Cecilia
equivocada.
had raised her hand, but maybe it was unintentional.
Ya que estamos sobre la hora,
Well,
antes que nada,
since
pues
we've
muchísimas gracias a
surpassed our
todos
allotted time, I would
por
just like to
haberse
thank all
conectado
of the participants for
estar
listening in,
presente en este evento.
for
Para
taking
mí
part in this event.
personalmente es
To me
un gran
personally,
placer
this has been
poder
a
hacer
true
este
pleasure
lanzamiento como uno de los últimos eventos que voy a hacer
to
como
take part in this launching as one of
asesora
the last
de
things that I
la
will do
Organización
as an
Panamericana de la
advisor
Salud.
at the Pan American Health
En
Organization.
ese sentido, quisiera agradecer a todos,
So
a
that said,
todos
I
por
thank everyone
efectivamente hacer
for
realidad muchos de los cursos que hemos podido
helping to make
lanzar
a reality
dentro de lo que es la
so many of
unidad
the
de
courses
recursos humanos
that at
de la
our
salud.
HR
Un
unit for
especial
health we
agradecimiento
were able
al
to
staff
release, to launch. I
y al equipo de Gabriel, a
thank Marita,
Gabriela,
commend her and the whole
que ha
team,
estado
Gabriela and
poniendo
Gabriel,
lo mejor de
who
ella
have
como para
put
que esto sea
Gabriela,
una
who
realidad
has
y a la
done,
vez
given the best of
tratando de
herself
mejorar las apariencias, cómo aparece, cómo puede ser más
to
dinámico, más
make the
entretenido y
course look
más
better, be more dynamic,
que
more
se pueda
entertaining,
transmitir mejor
engaging,
la
to be able
información, mejores
to convey
conocimientos.
more
Y
effectively
comentarle que
the
detrás de
knowledge and
esto
information.
hay muchísima documentación
Now, of
de
course,
respaldo
there
que
is
puede
much
ser muy útil para
substantiating
todos
information,
aquellos
support information
estén
available
en el
for
proceso de la
those who
gestión y de la
take the course,
planificación.
all of which can be very helpful in your
Realmente
planning and
no se me
management of
van
HR
a escapar muchos
efforts. So
nombres en este proceso de
certainly
agradecimiento.
there
Por lo tanto,
were so many people
no,
involved in
no
this.
está allí
I would have to
dar nombres para
thank them all,
reconocer, pero cada uno de ustedes sabe lo que han
but that
contribuido para
would take
hacer
too long.
realidad
So everyone
este
knows
curso.
what you have
Así
contributed
que
to
nada
making
más
this course a
darles
reality.
muchísimas
So
gracias y un
thank you
fuerte
very
abrazo
much.
a todos
A
y
warm hug
hasta
for
la
everyone,
próxima.
and
Gracias.
until we meet again, thank you.